What is motor mapping during craniotomy for brain tumors? Imagine having a map of the brain that guides surgeons to avoid causing harm while removing a tumor. That's what motor mapping does during a craniotomy for brain tumors. When a tumor is near areas of the brain that control movement, like the motor cortex, surgeons need a way to find and protect these vital regions. Motor mapping is a technique that helps do just that. It involves stimulating parts of the brain during surgery to see if they control movement. This is especially important because damaging these areas can lead to weakness or paralysis. During an awake craniotomy, the patient stays conscious for part of the operation. This allows the surgical team to check how the patient responds in real time. The surgeon gently applies small electrical currents to specific spots on the brain's surface. The patient might be asked to move their fingers, toes, or limbs. If a movement occurs or stops when a certain area is stimulated, the surgeon knows that spot is involved in motor control. This way, they can avoid damaging it while removing the tumor. There are two main types of motor mapping. Cortical mapping targets the surface of the brain, helping identify the motor cortex itself. Subcortical mapping looks deeper, focusing on white matter pathways that carry signals from the brain to the spinal cord. Both methods help define safe boundaries for tumor removal. Sometimes, additional tools like electromyography are used to record muscle activity, or electrocorticography to monitor brain signals during surgery. These help ensure the motor pathways stay intact. Before surgery, doctors might also use imaging techniques like functional MRI or navigated transcranial magnetic stimulation. These preoperative maps help plan the safest approach and anticipate any shifts in brain anatomy caused by the tumor. Overall, motor mapping is considered a gold standard because it makes tumor removal safer and more precise. It requires a skilled team and specialized equipment, but it greatly improves the chances of removing the tumor while preserving the patient's ability to move. Always remember, each case is unique, so it's essential to discuss options with a healthcare professional who can tailor the approach to individual needs.